So, hi friends, I am Dr. Anshul Bansal, again joining you on the Unacademy platform. As you all know, I am here to guide you through your preparations for the study of orthopedics so that you can crack your NEET PG examination. As you all know, the NEET PG for 2021 is scheduled next month. So, yes, prepare well, do questions, Anna, and we'll have special sessions for that examination also. Currently, I am working as an orthopedic house surgeon in SMS Hospital, Jaipur. Okay, I've cracked the NEET PG examination last year, that is in 2020 only. Uh, Here we'll study orthopedics and in-depth orthopedics so that it will be helpful not only for your NEET PG and INI-CET exams, etc., but also for the professional students who are giving their professional and university examinations. And we'll be dealing more with clinical scenarios and x-rays and images, keeping in mind the new pattern for the NEET PG as well as the coming next examination. So in today's session, we'll study about recent advances in orthopedics. Okay, and before beginning the session, let me tell you about our subscription plans for NEET PG on Unacademy. We have two types of paid subscription. First is the Plus subscription, in which you can access both live and recorded classes anywhere and anytime. Okay, and we have a bunch of India's top educators, so you will be studying with them. Also, you can compete in live tests and quizzes, and you can log in to a multiple devices, so you can study at any device of your choice at any time. And we have a great QBank. It will be accessible to the plus subscribers. And also we are coming with new printed notes that will be available for the subscribers. Okay, and you can use this code to get extra 10% off. Okay, and the second one is the iconic subscription, in which apart from the things that I've told you earlier, you will get prep ladder, and with prep ladder you will get all of its question banks and video lectures and rapid revisions and all of the prep ladder. Plus, what other things you'll get on Unacademy? You will get well structured live batch wise classes, and we have structured a course in such a manner to clear your basic concepts first, then move on to the next part. And we will try to correlate different subjects with each other, so it will help you to better understand the things. And also we'll be having live tests and quizzes for the iconic subscriptions, and you'll get your individual assessment so that you can see where you are lagging behind. Okay, you can again use this code to get extra 10% off. Okay, and targeting different bunch of examinations like FMG and NEET PG this year, and next 2022 we have started batches focusing on particular examinations. Okay, and for the NEET PG, last 1 month is remaining. We have started a 1 month special package in which you will get all questions and GTs and last year revision questions. Okay, all clinical scenarios. You can subscribe for this package, and you can use this code to get extra 10% off. Okay, and we have scheduled this grand series or test series also. So grand tests are very important, and you should give at least 4 to 5 grand tests per week. Okay, and we are running a limited time period offer, for in which if you will buy any subscription of 12 months, you will get 2 months of it is absolutely free. And also we are giving a heavy discount on the 4-year subscription packages, the foundation packages. Okay, so you can use my code to get extra 10% off. Okay, and I'll suggest you to buy plans which have longer duration, because first the per month cost decreases significantly, and secondly, keeping in next pattern, you need to build your concepts from the starting of the MBBS only. Okay, and we have special classes which is available on Unacademy application, and you need to subscribe on the Unacademy app, and both of which are absolutely free, in which you will get live classroom like feeling where you can interact with your educator, participate in the polls, clear and your doubts. Okay, and you can see it anywhere, anytime, and you will be notified regularly so that you will not miss your classes, and you will be given lecture notes in the digital format. We are also running a bugs bounty program, in which if you find any inappropriate content in any of the video of our educators, you can contact our team. The link is given below, and if you are found correct, you will be given handsome prizes and offers. Okay, so let's start today's class. Today's class is about recent advances in orthopedics. Okay, so the recent advance is the AO method of fracture treatment. Okay, AO is a Swiss word, and its English counterpart is ASIF, Association for the Study of Internal Fixation, in which internal fixation is more helpful according to this method. Okay, now we have already discussed what is internal fixation. Internal fixation means fractured segments को reduce करके you have fixed internally with the use of implants and with the use of operative techniques. So earlier the thing was that operative surgeries were not the treatment of choice in orthopedics because of more disadvantages and more risk factors related to the surgery. Okay, so earlier close reduction was tried, and more of slab casts and conservative techniques were used like tractions and all. But now the concept has shifted, and the concept is that you have to early mobilize the patient, so that जो सबसे बड़ी प्रॉब्लम होती थी पुराने way of treatment में was that कि there was stiffness of the joints around the fracture, because long term cast and slab में रहने की वजह से it was a major problem leading to deformities even, है ना. So to allow early mobilization, obviously you have to fix the fracture segment or displace now. So for doing that you need to insert implants. You have to fix it by the internal fixation. Okay, so internal fixation, or the new treatment by the AO method, this avoids the advantage of stiffness of joints, muscle wasting and all of this, and this term is called fracture disease by them. Okay, this term is called as fracture disease by them. Okay, so in the new principles, okay, according to the AO method, this stable internal fixation can be achieved by three methods. First is interfragmentary compression, means if this is the fragment ना, first you need to reduce it, and इन दोनों fragments के बीच में ही you need to fix it by a screw or any wire like thing. See this. Okay, here you can see. Okay, this is your fracture line. This red one is your fracture line, suppose, and this is the interfragmentary implant or interfragmentary screw. Okay, and by tightening this screw you will get compression, and the plate will fix over the bone, keeping the fracture line reduced. Okay, and splinting, which can be second is the splinting, external or internal by external fixators etc, and internally by plate or nail. Okay, this is interfragmentary thing, and the plate will be the internal splint. Okay, and the third technique is combination of both, like we have seen in the diagram. Okay, so first we'll study about the interfragmentary compression. Okay, interfragmentary compression, as I have taught you earlier, it can be done by a screw or wires etc, and इसका क्या रोल होता है? इसका ये रोल होता है कि merely sometimes क्या होता है, fragments जो होते हैं, the fracture fragment just splinting or just compression forces से भी they get displaced sometimes. So for proper fixation you do a screw insertion or a wire insertion between the both fracture segments. Okay, so it can be achieved by two ways. First is static and the second is dynamic compression. So static compression is what we have discussed till now, where the compression is produced at the time of surgery. Okay, so इससे क्या होता है, fixation और proper and और strong हो जाता है. And what is dynamic compression? Dynamic compression is provided by the muscle pull and the muscle contractions of the limb. Okay, so and now static compression, dynamic compression तो अपने आप हो जाएगा. Now static compression is done at the time of surgery. So what are the different methods of static compression? Okay, so static compression first of all can be provided by leg screw. Most commonly used for static compression is the leg screw, in which, like we have taught, this is the fracture site. So here we have given this splint by the plate, and for static compression or interfragmentary compression, connecting the two fragments, we have drilled a hole and put a screw in it. It is called as lag screw fixation, so that the fracture surfaces are compressed more against each other. Now the proximal cortex जो होता है of the fracture segment is over drilled so that head पूरा अंदर चला जाए, and the distal part of the screw में there are threads, so that thread will get tightened and hit the opposite cortex. Okay, see, like this the posterior cortex will be drilled, but nowadays there are different lag screws. Okay, so in this you don't need to over drill. This proximal or initial part जो होगा screw का, that do not have threads, तो वो वैसे ही over drill करने की जरूरत नहीं है. The head will go down. Okay, so this is leg screw fixation. See here, you can clearly appreciate the leg screw fixation passing through the fracture site. This is the fracture segments in your 3D view. Okay, and from the opposite side, if you will see, you can see like this for additional stability. Okay, now second can be the compression plating. The compression plating plates are thick metallic plates which are used to fix the fracture sites. Okay, now there are different types of compression plates, like locking compression plates, dynamic compression plates, etc., and we'll study them about in the slides coming later. Okay, so compression plate is this. Now the compression जो होता है वो दो तरीके से हो सकता है. First एक clamp होता है. The name of the clamp is the Muller's compression clamp, and the other technique is the self compression plates which are used nowadays. Okay, and the third thing we can use for interfragmentary compression is the external compression, where you put pins and external assembly from outside the skin. You don't reach the fracture site, you just put pins, drill through the skin and the bone, and then by compressing the nuts and the assembly, you bring the fracture sites in alignment and keep them compressed. See, this is a example of compression plating, where एक hole यहाँ में लगा है, दूसरा hole we have put eccentric. This is concentric, this is eccentric. So we have put one eccentric. So when you'll tight this screw now, the compression will be in this direction, so this will get compressed. This is an example of compression plating, like in both bone forearm fracture. This is an example of compression plating. See, okay. And what is external fixator? As I have told you, without reaching the fracture site, without opening the fracture site, we have just put two pins and attached a fixator assembly, and then by these screws and all, you can compress the fracture line. Okay, it is mostly used for non-union fractures or compound or open fractures. Okay, now we'll come to methods of dynamic compression. Okay, dynamic compression, as we have studied, mostly it can come from the muscle pull, but there are other ways to produce dynamic compression. Okay, and every fracture bone में एक tension side होती है. Tension side is the part which have the most probability to get displaced, है ना? And it can open up, or it can just get removed from the alignment of the normal bone. Okay, so to counter this force now, we have some devices, and this is called tension band principle, where you fix a implant at the tension side. Okay, so the dynamic compression can be attained. The most commonly used thing for this is the tension band wiring, or TBW, and it is used for 3 fractures very commonly: fracture of patella, fracture of olecranon of ulna, and fracture of medial malleoli, which is a part of tibia, distal tibia. Okay, and there is also a tension band plate which can be used for humerus and tibia fractures. See, this is tension band wiring of patella. See, we have created a dynamic compression, and first we'll put these wires and then roll over the stainless steel wire and tighten it to give the compression. Okay, and see, this is a compression band plate in the femur. Okay, here you can see the lateral side is the compression side, and here we have put just for the compression so that tension wale area pe it doesn't get displaced. Okay, see, this is compression wire. Okay, so now we come to the second thing. After interfragmentary compression, we come to the second thing, that is splinting. Okay, splinting means what? Splinting means एक तरीके से जो भी फ्रैक्चर है उस फ्रैक्चर को फिक्स कर देना विदाउट putting any implant through the fracture site. Okay, this is called splinting. Okay, so there are different types of splinting, like intramedullary splinting, extramedullary splinting, okay, and splinting outside the body. So first we'll read about the intramedullary splinting, and the most commonly used thing for this is nail, intramedullary locking nail. Okay, and it is used in the fractures of long bones, especially fractures of shaft of femur and tibia, or in other long bones like humerus also. Okay, it is a long hollow nail which is inserted in the long bone, and these are locked by post proximal and distal screw. See, this is intramedullary splinting by a nail in fractured tibia. This is tibia, and the good thing is this nailing was done by me just a few days ago, so I have shared this x-ray. So now see, एक साल पहले तक I was a student like you, but 1 year from now I am doing such kind of stuff, and Sachim, it feels good. So just 1 month left. Don't lose hope. You know everything. Just revise and stay healthy, eat healthy, and tension nahi lene ka bilkul. Okay. See, this was my first nail done just a few days ago. So it is intramedullary splinting. Okay. See, this is the fracture site broken. We have put a nail here, locked it, and then see, callus formation occurs, and you can also remove this nail. Okay, now extramedullary splinting. Extramedullary splinting will not reach the medullary cavity of the bone. Okay, so cortex se hi hoga. So this is extramedullary splinting done by plate. Okay, and sometimes we have seen LCP, DCP, those were compression plates, these are not compression plates without producing compression, है ना. यहाँ पे they don't produce compression, they just splint the fracture site. Okay, so these are called as the neutralization plate. Okay, these are called as the neutralization plate. Or there is another type of plate which is called as the buttress plate, especially in distal femur and proximal tibia के condyles वाले part में. Okay, where they also just buttress the fracture site and they just provide a support, they do not compress it. See, this is a neutralization plate where screws यहाँ लगाए हैं and यहाँ पे कोई compression नहीं है. Okay, and see, this is a buttress plate in the proximal tibia. Okay, and by splinting outside the body, like in external fixators, and this is a very important technique about which we will study in the further slides. This is the Elizaros technique, in which the splinting is done from outside. And how it is done? It is done by inserting these pins, okay, and adjusting this assembly, and then you can put the fractured segment in alignment by adjusting the screws and all. Okay, so these are external fixators. Okay, now mostly combination of compression and splinting are used. Okay, and it all depends on the fracture, the age, the choice of the surgeon, है ना. And also sometimes fracture में you don't appreciate so well, but and then you open the fracture site, you see very different thing there. Okay, so it is a combination of both generally. Okay, see, in this diagram you can see this is fracture of shaft of femur. Here we have put a nail, which is a form of splinting, intramedullary splinting, and also to compress the fracture site for more rigid compression we have done interfragmentary compression also. Okay, we have done interfragmentary compression also. Okay, this is an example of combination or both. Okay, and another example is femur fracture है यहाँ पे, so we could have put a see, we another thing we could, what could we have done? We could have put a neutralization plate here, ना, यहाँ पे screw, then we could have reduced it and put interfragmentary compression screws also. Okay, but we have and we have different choices. But इसमें क्या होता है? इसमें you need to open the site to put this plate inside or adjacent to the zone. Okay, so इसमें obviously बात है exposure ज़्यादा होगा, infection and other surgery के surgical complications के chances ज़्यादा होंगे, so we have gone for this here. Okay, so now the AO concepts are also changing. And what are the changing AO concepts? Like we have discussed before 50s na, fractures were treated mainly non-operatively and with the help of callus formation. Okay, callus formation was the main concept behind the healing of fractures before 1950s. Okay, but as we have discussed, non-operative के अलग अपने फायदे थे, but there were various disadvantages, like we have discussed fracture diseases, stiffness and deformities and muscle wasting and all. And also at that time the operative techniques were also not evolved like they are evolved now. So now we are more towards the operative techniques. Okay, now in the late 50s and 60s ज़्यादा जल्दी वेट bearing and mobilization कराने के लिए the internal fixation was used more often, है ना. And the proposed anatomical reduction of the fracture, we have to internally fix ताकि वो हिले नहीं. Now in intra-articular fractures, now if the fractures is intra-articular, you need to fix them internally and rigidly in all cases. Okay, in all cases. So the fragments were rigidly fixed using AO principles, and now the aim of rigid fixation जो था वो callus formation नहीं है. The aim of rigid fixation is bone to bone compression, है ना, which is called as primary bone healing. Okay, which is called as primary bone healing. बट इसमें क्या होता है, आपको रिजिड करने के लिए आपको फ्रैक्चर साइट को बिल्कुल एक्सपोज करना होता है, एंड दिस लीड्स टू डैमेज टू इट्स ब्लड सप्लाई. ओके, विच विल लीड्स टू इट्स डैमेज टू इट्स blood supply and delayed healing. Okay, so in 90s इसमें भी evolution हुआ. In 90s to reduce this compression के लिए जो bones बोन एक दूसरे से बिल्कुल टच रहती है, एंड द प्लेट्स आर आल्सो टच्ड ऑन द बोन, जिससे पेरिओस्टियल एंड ऑल ब्लड सप्लाई का लॉस होता है, प्लस you have to reach the fracture side. So we have come from rigid fixation to a stable fixation now, है ना. So stable fixation is you don't have to be rigid, you have to just provide the support. So now जो plates भी आती है, the plates have a slight gap between the cortex of the bone and the plate. There is a slight gap. Okay, so that the periosteum blood supply that is not hampered. Okay, so as we have discussed in intra-articular fracture, stable fixation means absolute stable fixation, and similar to the earlier AO concept. But for the diaphyseal fractures now we have change the guidelines now, and we prefer for less rigid fixation. Okay, and इसका क्या होता है, anatomy is not hampered and you get more biological like feeling, है ना. blood supply ही poor हो जाएगी, या फिर the periosteum is broken, so the healing is very poor. Okay, so see, for example, this is a fracture of the distal femur. See how commuted this is, टुकड़े टुकड़े हो रखे हैं मतलब, है ना. So what we have done here, in the past the guideline was कि open all of this area, है ना, and then rigidly fix it. But now in this table we have not opened the whole of the area, we have just inserted a nail, we have put screws here, fix the length of the fracture, and without opening too much by using MIS. Okay, MIS is another recent advance, which is minimal invasive surgery, in which we give यहाँ से यहाँ तक पूरा नहीं खोलेंगे, we'll only put incision here and here, and using C-arm machine. It is a portable X-ray machine. We'll put the screws here and see how well it has worked. After a few months the callus has formed and the bone has healed. Okay, so this. Okay, now stabilization के लिए we can use different types of plates also, like bridge plate. Okay, see, this is the C-arm machine that I was talking about. Okay, this guy has wore the lead apron. In OTs we also wear lead aprons regularly, because nowadays C-arm is available in almost every good orthopedic center. Okay, so our hospital have around, we have 9 C-arm machines per hospital. So see, the patient intra-op, this is a portable X-ray machine. You can just give a shoot and you can see there and there in the monitor. Okay, so this has really evolutionized the orthopedics. Okay, so So the relative stability provided by these devices is good enough to allow early mobilization. But since blood supply of the bone is preserved, the chances of fracture healing are better. Okay, so now the emphasis has shifted from direct reduction where fragments were exposed to indirect reduction like we have discussed above, with the use of CR machine and more manipulation by moving the limb. Okay, see, this is a bridge plating where you just put a plate like it, like a buttress plate, and you just bridge this both fractured segments. You don't go for the opening of this part and doing rigid fixation. Okay, so blood supply कम damage होगी इससे. ठीक है. Now in general the best implant or the best way to fix is nailing, and that too intramedullary nailing is considered best, especially for the long bones na. For long bones and closed cases without any external injury, intramedullary nails are the preferred choices. Okay, intramedullary nail is the preferred choice because this nail acts as a load sharing device. Load is shared between the nail and the bone both. Okay, but the only disadvantage that too in the conventional leaning. Now the nails भी काफी evolutionized हो गई है, बहुत अलग अलग तरह की nails आती है like distal tip or expert nail, है ना, with nails with antibiotic coating around them, titanium nailing, है ना, etc. But the only thing is they don't provide the rotational stability of the fracture. ओके, सी प्लेट है तो प्लेट बिल्कुल चिपकी हुई रहती है फ्रैक्चर साइड्स की, तो यू कैन मूव इट, बट इफ इट्स नेल ना, तो इट विल बी वेरी डिफिकल्ट टू get the rotational stability. Okay, now nowadays to provide this rotational stability now we are using the interlocking nail where the proximal and the distal screws are put. ठीक है, and when the fracture is healed and callus बन जाता है, sticky हो जाता है, then we remove the screws. Okay, that is called as dynamization. So after removing the screws they get the rotational stability also, and we also have different screws called dynamic screws in the nail which help in the rotational stability. Okay, so we nowadays use interlocking milling. Okay, like we have I've seen the x-ray now, we have seen this x-ray where it is. Yeah, here it is a interlocking nailing. Now प्लेट्स पे आते हैं. नाउ स्टार्टिंग में जो फर्स्ट प्लेट दैट वाज डीसीपी डायनामिक कंप्रेशन प्लेट. नाउ देन द ट्रेंड शिफ्टेड टू दिस एलसी डीसीपी low contact dynamic compression plate. Now the newest and most recent is the LCP, which is the locking compression plate. In dynamic compression plate the plate बोन से बिल्कुल चिपकी हुई रहती थी एंड स्क्रू से कंप्रेशन आ जाता आफ्टर रिड्यूसिंग द फ्रैक्चर साइड. इन LCDCP so that your periosteum and around की blood supply don't get damaged too much, there came a low contact dynamic compression plate जिसमें there was a little gap between the plate and the bone cortex, and इसमें all latest development is the locking compression plate. Okay, in locking compression plate what do you get? See, this is you get holes of different variety where you can put two types of screws, dynamic and the static screws. Okay, and in various directions also. ठीक है, and also the cortex is not touched by the plate and the periosteal blood supply is not hampered. ठीक है. So Now, what is the difference between these two? Okay, see, this is the LCP, in which, see, you have this screw here and also you have another screw here, and दोनों screw का head भी अलग होता है. ये जो छोटा वाला head होता है, this is more for this dynamic compression, and it is more better because यहाँ पे the screw head goes inside and it does not hamper the blood supply, and you can go for different directions and for the unicortical screws, etc. Okay, see, like this. Okay, and these are the different type of interlocking nails and different types of the screws. Okay, see. So the screw hole has two halves. One half is a conventional DCP hole and the other half is threaded. Okay, like here in the screw you can see one half is a conventional and the other half is threaded. Okay. Now the screw head also has threads, so that as the screw is tightened, the head gets locked in the plate. See, the screw head is also having the threads. Okay, now LCP plate not only can be used as a compression plate, it can be used as a neutralization and buttress plate, etc. How? See, if this is the fracture site of a bone ना, so ये प्लेट लगाई अपन ने, यहाँ पे भी अगर अपन स्क्रू लाए तो कंप्रेशन हो जाएगा, बट यही प्लेट अगर ये फ्रैक्चर साइड पे, you have put this plate here and screws if you put here na far away from the fracture site, so it will act as a buttress or bridging plate and also as a neutralization plate. Okay, and periarticular मतलब near to the joint surfaces पे अगर fracture है, so this LCP plate is very useful. Nowadays different types of plates like carbon and biodegradable plates, etc. are used. Okay, now we come to another important thing, which is the functional bracing. Okay, now what is functional bracing? Brace, you all know, brace में क्या होता है, limb के ऊपर you put a supporting element so that it is helpful for the immobilization of the fracture segment. So functional bracing में क्या होगा, जो normal brace होता है like that of a पीओपी स्लैब और कास्ट, उसमें फंक्शन इम्पेयर्ड हो जाते हैं ऑफ द जॉइंट्स बिलो एंड अबव, एंड ऑल्सो देयर इज अ लॉट ऑफ कंप्रेशन. बट इन फंक्शनल ब्रेसिंग क्या होते हैं, द जॉइंट्स आर फ्री एंड ऑल्सो देयर इज नो कंप्रेशन, सो क्या होता है, यू गेट अ बायोलॉजिकल फील. Okay, so this is called functional bracing. First of all, it was popularized by Sarmiento. Okay, and bracing ऐसे नहीं है कि अब फ्रैक्चर हुआ और आपने इमीडिएटली ब्रेसिंग कर दी. नो, for the initial 2 to 3 weeks where there is high inflammation and more chances of displacement, you cannot do functional bracing. Okay, functional bracing is done when the infection, if it is open or the inflammation has subsided. Okay, so as we have discussed, the whole leg is enclosed in the confined space. Okay, so this develops a sort of hydraulic pressure within the brace and it helps in maintaining the fracture alignment. See, this is functional brace. यहाँ पे joint movements will not get impaired. Okay, but the fracture site will be fixed using this bracing. Okay, but bracings may not reduce the time taken. ये है कि bracing से ऐसा नहीं है कि fracture का union जल्दी हो जाएगा. No, bracing will not reduce the time, but bracing will improve the patient's conventionality, मतलब it will improve the patient's day-to-day activity and mobilization. Okay, so see, and the most popular thing that we use for functional bracing is the Elizaros technique. So basically functional bracing अपन एकदम से यूज नहीं करते, so there is a proper channel या orthopedic कोई भी बहुत ही grave orthopedic injury है, so it requires a proper path. See, first, if there is compound, very compound, dirty fracture, है ना, so first you'll debride it at the emergency or casualty. You'll put the slab and then you'll shift it to the ward. In ward, the orthopedic surgeon will see to it, will, and here you have to check for the vessels and nerves. Then the orthopedic surgeon will do the major surgery where he will again debride the wound and fix the fracture sites by close reduction or by external fixation, or sometimes by internal fixation, which is very rare. Okay, and then the patient is shifted to the plastic surgery, and there wound management is done. Okay, wound care is done, and proper flap or grafts leke you put a new skin, and when the wound is good with new skin and no infection or very less infection, they again has to go to the orthopedics for like after 3 to 4 months. Okay, and the orthopedics now do the definitive surgery by internal fixation, like by plating or nailing or etc., and grafting, or by this functional bracing technique. Okay, so this is the path which is followed. Okay, so now functional bracing में सबसे important and सबसे popular thing which we use is the ring fixator, which is called the Elizaros technique. It is like a boon to the orthopedics. Okay, and obviously you can appreciate that it was discovered by Gabriel A. Elizaro, a Russian surgeon. Okay, and it is nothing but an external fixator only. We have seen the image. Yeah, see, this is the Elizaro. It is just like a external fixator only. But mind you, this is a very complex surgery and requires years of experience. Okay, so it is used for the treating the most difficult orthopedic problems, not just fracture, but deformity corrections, no, or congenital deformity corrections. Okay, so this is used for the major orthopedic problems. Okay, now it works on one principle, and its principle is that osteogenesis requires dynamic state. Okay, now we are not here dealing about fracture healing or callus formation and all, because अगर वो होना होता तो वो हो चुका होता. If the इससे पहले जो previous treatments है उसकी वजह से the fracture is not united or there is deformity, then to correct that thing we use the Elizaros technique, and in which नई bone बनानी पड़ती है, simple as this. Okay, bone healing नहीं, we have to form new bone na, so that is called osteogenesis, and it occurs around the fracture. Okay, so बेसिकली एलिजारो टेक्निक का एक प्रिंसिपल है कि कोई भी नई चीज बनाने के लिए या ऑस्टियोजेनेसिस करने के लिए आपको घर जैसा माहौल बनाना पड़ता है, यानी यू हैव टू प्रोवाइड द बायोलॉजिकल लिविंग स्टेट. ओके, आपने अंदर प्लेट लगा दी, नेल लगा दी, कास्ट कर दिया जिससे आसपास के जॉइंट्स मोबिलाइज नहीं है, मसल कॉन्ट्रैक्शन नहीं हो पा रहा, और यू हैव हैम्पर्ड द ब्लड सप्लाई सो मच, so that is not actual biological state. Okay, so इसमें कैसे होता है, first of all joints are not involved, joints can be moved, है ना, weight bearing, मतलब after one day ही weight bearing start करा देते हैं, है ना, and blood supply is also not hampered because very thin stainless steel wires are put across the bones, and they are connected to the assembly in such a way that it creates a circuit, and by tightening or losing the screws you can put the compression as well as distraction. ओके, दिस इज द इम्पोर्टेंट. अभी तक अपन सिर्फ और सिर्फ कंप्रेशन के बारे में बात कर रहे थे, बट टू करेक्ट द डिफॉर्मिटीज यू समटाइम्स नीड टू डिस्ट्रैक्ट द बोन ऑल्सो. सो this technique of distraction, first of all, it was possible in Elizaros technique only. Okay, so this dynamic force by the muscles and all, when properly applied, causes the dormant mesenchymal cells at the non-union site to differentiate into the functioning osteoblast and leading to bone synthesis and healing. Okay, so as we have discussed, distraction osteogenesis जो वर्ड था वो पहली बार एलिजारो टेक्निक से ही आया. उससे पहले we were only concerned about the compression. Okay, so according to this, any living tissue when subjected to constant stretch under biological conditions, यानी घर वाली फीलिंग. So this biological condition is provided by first allying the fracture with minimal damage to the vascularity, we have discussed it, and allowing the joints to move, and also important part, performing an osteotomy. Osteotomy like the limb lengthening surgeries, like यहाँ पे ये हो गया, ठीक है, there is overlapping, so you do the osteotomy, you cut this part and यहाँ पे gap छोड़ देते हो, but the forces, the dynamic forces and the biology and is so much that there's transformation of mesenchymal cells into osteoblast, and there is formation of new bone in this empty segment. Okay, so this osteotomy done by Elizaro is called as corticotomy, and in Elizaro technique we very oftenly do the corticotomy. See, this is the bone part and we have done this corticotomy. This is the corticotomy here, this is the bone gap, and you can see after few months there is formation of new bone, there is osteosynthesis, and for this, see, now we'll study in short about the fixator assembly which is used in this technique. As you can see in the image, it is in the ring, so it is also called as the ring fixation. Okay, and ring fixation में जो pins होती है, they are very thin, very less in diameter, especially designed, so this protects the growing tissue from bending or shearing forces, but also permits loading along the long axis of the limb. Okay, so distraction is done 1 mm per day के हिसाब से, and also there was one thing जहाँ पे 1 mm per day start हो रहा था, that was nerve regeneration. Nerve also regenerate at 1 mm per day, and the distraction or compression in the Elizaro technique is also made 1 mm per day, and that too in 4 sessions. कितने session में? In 4 sessions of 1/4 mm per day. So we say to the patient, we give the instruments that is called the Allen key, and other instruments also. So we give that key to the patients and उन्हें समझाते हैं कि in every 6 hours 1/4 turn इसका इस direction में घुमाना है. Okay, so the distraction or compression occurs in a regulated manner. Okay, see, earlier इसको nail there were the intramedullary nail was used, but the callus formed, but there is distraction. Okay, so you can see there is distraction, so इसको वापस alignment में लाने के लिए we have put a Elizaro ring. We have used this Elizaro technique, and by proper distraction in all the directions by 1 mm per day, we have put the bone in alignment. See, this is now in the alignment. This is the beauty of Elizaros technique. Okay, now as we have read, ring fixation consists of inserting thin, only 1.5 to 1.8 mm stainless wires outside the limb. The wires are attached to the steel rings, as we have seen, with the help of bolts, and before fixing the wire to the ring, wire is put under tension as so as to make it stiff. See, यहाँ पे wires जो है वो मुड़े हुए हैं. So this is a different type of key. Okay, so we rotate this wire with the help of an instrument, है ना? So जिससे ये wire gets stiff. Okay, so the rings are then interconnected with the help of threaded rods, as we have done, and it is fixed with nuts. Okay, and then these are used for the compression and distraction here. Okay, now Elizaros technique uses. First, I've already taught you limb lengthening. Second, non-union maybe it can be used. Okay, so how it is used in the limb lengthening? By giving the biological environment and by compression and the distraction, and with the help of corticotomy. Okay, it corrects the deformity and it produces the lengthening, and it can be lengthen up to even 18 inches. Okay, I have even seen. See, this is the X-ray. Okay, before the surgery it was like this, and after few months it is like this. So this is limb lengthening. It is very useful. Okay, second is the non-union. By conventional or other methods, we have tried to unite the bone, but due to infection or other reasons, union is not possible. So we can go for the Elizaros technique also. Okay, and it can also be used as a one-stage fixer. One-stage fixator means injury hote hi you can go for the Elizaros fixator also, Anna, in compound cases also, and it can be also used as a one stage thing in the compound cases or the open cases for treating the congenital or acquired deformities. Okay, and in osteomyelitis also, because it gives the normal biology like environment, and also it is external fixator, so you can debride it from the external environment also, again and again. And for doing arthrodesis, by giving the compression forces, you will crush the intraarticular surfaces of the bones. Okay, and you'll make them fix with each other, and there will be new bone formation, and that will do the arthrodesis. So what is arthrodesis? Arthrodesis means joint ko hatana, not by excision. If the distal surfaces of the joints are in alignment and there is high level of arthritis around the joint and it is unrepairable, so what we do, we compress the bone fragments with each other, like by the Elizaros technique, so that वो joint ही खत्म हो जाए and that whole forms one bone. So इससे क्या होगा, movements तो loss हो जाएंगे, there will be very less movements, but the major thing a patient wants is कि डॉक्टर साहब प्लीज हमारा दर्द कम कर दो. So the pain will vanish away. Okay, so for pain and for any person, pain is the most important thing which जिसके लिए वो डॉक्टर के पास आता है. Okay, so this is arthrodesis. So what are the advantages of Elizaros? The advantages are immediate load bearing करवा सकते हैं. Okay, a healthy viable bone in place of a devascularized bone, and grafting Elizaros के साथ generally we have to do the grafting also, and we can correct one or more problems in a single go. Like Elizaros लगा दिया, so you can fix the bone as well as you can take care of the wound also. Okay, and what are the disadvantages? It is an external fixator, तो obviously बात है it will hamper. अगर आपने इसी जगह प्लेट लगाई है तो प्लेट दिखेगी भी नहीं, and the patient can walk, he can walk in Elizaro also, but yes, obviously if there is a cage around your leg na, it will be not convenient, and there is long duration of the treatment. Okay, and there are chances of pin tract infection also, or if the pin have hit any vessel or the nerve, है ना. And if there is transfixation na, across joint we put Elizaro rings na, to treat some deformities. Okay, so if that is done transfixation, so joint stiffness can also occur. So see, this is the bone, na, ये bone we have removed. See, there is bone loss here. Okay, accident से bone loss हो गया, or this bone has got necrosed, we have removed. Now we have put this Elizaro cage, we have done the corticotomy, we have put a little bone graft here, and see, when this callus is beginning here or healing, new bone synthesis is happening here, we are distracting it, or we are compressing. यहाँ पे तो compression, यहाँ पे distraction by these frame and the bolts, and see new bone formation. So it is a boom for orthopedics. Okay, so this was about the recent advantages in orthopedics. Okay, so I'm planning a special class on Wednesday 11 for on a very important topic in orthopedics, one of the most important topic in orthopedics, that is bone tumors. And out of 200, at least one or two questions इसमें से पक्का आएंगे ही आएंगे. Okay, so for please join this special class, and for joining this special class you just need to subscribe, which is absolutely free, and you have to download the Unacademy Learners app, which is available in Android as well as iOS, and which is also free. Okay, so please go for the subscription and download the app. And also, if you are planning for paid subscription, please use this code to get extra 10% off. So I hope you like the videos. If there is any doubt, you can type in the chat box. I'm giving you like 30 seconds or 50 seconds. I'm waiting for 30 seconds. Hi Abid. So if you like the videos, please like, share and subscribe. Follow our YouTube channel, Let's Crack NEET PG. Stay healthy, don't take too much stress, na? And just revise and do lots of questions. Okay, so see you, bye bye.